Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Spiromax inhaler so that you get the most benefit from it. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. You should always sit upright or stand up when using your inhaler. Hold the Spiromax upright with the mouthpiece facing down. Make sure that your fingers are not blocking the air vent. Open the mouthpiece cover by folding it down until you hear a loud click. Only open the inhaler when you're ready to use it. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Breathe in through your mouth as deeply and as hard as you can to make sure you inhale the full dose of medication. Remove the inhaler from your mouth while holding your breath for up to 10 seconds or for as long as is comfortable. Now breathe out slowly and gently away from the mouthpiece. Close the mouthpiece until it clicks in place. If your doctor has told you to take 2 doses of medication, repeat the process. Start by opening the mouthpiece cover by folding it down until you hear a loud click. Once you're finished, close the mouthpiece until it clicks into place. As your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. There's a counter on your inhaler to show you how many doses you have left. The number will turn red when there are less than 20 doses remaining. You should order a new inhaler from your GP at this time. To clean your Spiromax inhaler, wipe the mouthpiece inside and outside with a clean, dry, lint-free cloth to remove any powder residue. Never wash the inhaler with water. If you're unsure about how to use your Spiromax inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.